Here's Apical. Listen for a full minute. And I'll listen again with the Balopiscope for any irregular heart rates or beats. Perfect. Okay, Nick, we'll put your gown on. And we're just going to expose Nick's abdominal region here. Raise down just a little bit. And we'll bring the head of the bed down completely. I'm getting down at eye level just to check Nick's abdominal contours. And I'm going to auscultate Nick's bowel sounds. 1 minute in each quadrant. I'm also going to auscultate the aorta. I'll go ahead and percuss the abdomen. Okay, I'm going to do some light palpitation. Nick, you tell me if anything's sore or tender. Okay,
No.
Good. And we'll do a little bit deeper here. Good.
No.
Okay, we're going to palpitate for the liver, which should not typically found in a healthy individual, and kidneys as well as the spleen. I'm just going to put my gloves on to check for the femoral arteries, which are located right in the groin region. Perfect. Okay, Nick. Next we're going to take a look at your legs. I'm noting skin color. Skin is dry and smooth. Temp is warm. Go ahead and take your socks off here. Nick, can you feel me touching your toes?
Yes.
You can wiggle your toes for me. You can push down on my hands. Point your toes back up towards you. No shooting pains in the calves at all. And check calf refill in the big toes. And check in between the toes, especially important for our diabetic patients. Checking the bottom. I think we'll check for your pulses here, so your popliteal, your posttibial, and dorsopedis. All pulses are +2. Okay. Now we'll check for range of motion. So I'm going to have you bring your leg up. We'll bring it back down. We'll bring knee to chest. Back down. Hand out to the side for hip. Perfect. No issues there. We'll bring our legs up. Back down. Knee to chest. Good. And hip. Perfect. Okay, and for neuro, especially important, Nick, I'm going to have you take your right heel to your left knee and slide down your shin. Perfect. Same in the other direction here. Perfect. Okay, Nick, I have you sit up and come to the side of the bed. Down. Okay, from the front, we're going to check your upper extremities. I also, as I have him sitting here, I can check his skin turgor, which is intact. Less than 3 seconds. And can you squeeze my fingers as tight as you can? Perfect. And Nick, with your hands out in front of you, can you bend and flex at the wrists? Okay, go ahead, bring your hands on your sides. Bring your arms in for a bicep curl. And hands overhead and back behind you. No difficulties there, right?
No.
Perfect. We'll check for your sensation now. So Nick, with this being dull and this being sharp, I'm going to have you close your eyes and you can tell me what you feel, okay?
Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Perfect. And Nick, if I can see your hand, show me which direction with your finger being up and down. Go ahead and close your eyes and tell me which way your finger's going.
Up. Up. Down. Down.
Perfect. And with your eyes closed, I'm going to place an object in your hand. You can tell me what that is.
Key.
Perfect. And again, with your eyes closed, can you tell me when you feel the sensation?
Feel it. Feel it. Feel it. Feel it.
Perfect. And one more here, Nick. I'm going to have you take your finger and put to your nose. You're going to touch your finger to my finger and back to your nose again. A little bit quicker. Perfect. Okay, Nick. I'll tie you up in the back here. I'll have you stand. With Nick standing, I'm going to check his lower extremities. I'm checking for any edema, symmetry in the legs. Okay, and I have you turn around for me. Checking for any varicose veins that I may see. Pull up here in the back. Okay, Nick, I'll have you turn back around for me. And if you could just walk forward. Stop there and turn around, and as you walk back, we'll do heel to toe. Okay, walk on your heels, we're going to walk on your tippy toes, and we'll turn back around. And now we'll walk heel to toe like this.
Okay.
But you already did the other assessment, so that's perfect. Good. Perfect. When you turn around, and come back. Okay. And I'll have you face the wall for me now, Nick. And with your feet close together, hands by your side, I'll have you, actually we're going to open this up so I can see your back. I'll have you bend forward as far as you can go. You'll be touching your fingers in front of you there. I'm checking his spine. Okay, for any scoliosis, it looks even. We'll go ahead and stand back up. Okay. And bending just at the waist, I'll have you bend backwards as far as you can. Perfect. And come forward.